Hi, so this video we would like to talk about Antai Hospital's proprietary technology and treatment for a late miscarriage. So this video will focus about Antai Cervical Ring and under what specific conditions do we use, and then how late into the pregnancy can we treat this condition. So late threatened miscarriages are not as common as early miscarriages, because early miscarriages are the more common ones. Out of all miscarriages, 85% of them happen in the first trimester. So late pregnancy, it is very difficult for a potential miscarriage to happen because the pregnancy is already stable and then the placenta is already doing its best to protect the pregnancy. But in the cases that it do happen, Antai Hospital can actually have effective treatment to stop the threatened miscarriage from developing into an inevitable miscarriage. A lot of hospitals don't really accept late threatened miscarriage because they believe that it is very difficult to salvage the situation, and they do not want to interfere or impose any risk on themselves, because late threatened miscarriage indeed is a high risk situation, and procedures during this pregnancy, it's very dangerous, because if you do anything wrong or is there any misstep, it may affect the pregnancy. So a lot of hospitals and medical institutions do not want to take any responsibility, and they will simply turn down. But here in Antai Hospital, we have the specialties and our professionals who are very good at what they do, and we do not turn away late threatened miscarriages, because it is still a pregnancy, it is still a life that needs to be saved. So there are specific indications for late threatened miscarriage. So for the primary causes for late threatened miscarriages are two. First is a cervical incompetence. Secondly is a short cervix. These two conditions are the prominent causes of a late threatened miscarriages. So it is very important that before you go for pregnancy, we recommend that you go and do a comprehensive testing to prevent any of these conditions from happening in the first place. A preventive diagnosis procedure is very important so that no miscarriage or stillbirth will happen during your pregnancy. So if you have cervical incompetence, this can be acquired either naturally or artificially. For example, if you have undergone certain procedures that have weakened the cervical tissue, causing the cervical incompetence, or you are naturally born with cervix that has more connective tissue than muscle tissue, causing the cervical tissue to lose integrity and also its strength. So during late pregnancy, because of cervical incompetency, the cervix will dilate prematurely. Specifically, the outer orifice will dilate. And then if nothing is done, the inner orifice will also soon dilate. Once the inner orifice dilates, it is almost impossible to stop the miscarriage to happen. So how we treat this condition is that we apply our anti-cervical ring on the inner orifice. So if you secure on the inner orifice, the outer will not open, and also the inner will be secured, preventing any form of a threatened miscarriage. So this can be done before pregnancy, which is what we call a pre-pregnancy treatment, or even during your gestation. Although treatment during gestation is considered high-risk procedure, but our success rates are significant, and we are confident in our skill. So the second condition is a short cervix, also can be acquired either naturally or artificially if you have undergone certain procedures or surgeries or trauma that has affected the cervix. So short cervix, as the name suggests, is that women with this condition do not have a cervical length of healthy range of 3.5 to 4.5 centimeters. They do not have this cervical length. So if you do not have a minimum of 3.5 centimeters or 4, the pregnancy will most likely end in a potential miscarriage, because the length is insufficient to sustain the pressure of the growing fetus, especially a late miscarriage. The immense pressure on the cervix. So it needs at least minimum length of 4 centimeters for a successful pregnancy to develop into a successful labor. So how we treat this condition is that instead of one cervical ring, for a cervical incompetence case, instead of one cervical ring, we will apply 2 cervical rings, one in the inner orifice and also one in the outer orifice. And then this will significantly lengthen the cervix. So initially, let's say you have a 2.5 to 3 centimeter cervical length, which is considered unhealthy or dangerous for a pregnancy. These two rings can effectively lengthen, giving you a minimum of 4 centimeters. As long as you have a minimum of 4 centimeters, your pregnancy can be secured. So, similar to cervical incompetency, this condition, this treatment can be done before pregnancy and also during pregnancy, although we do recommend it being done before pregnancy because the success rates are almost 100%, and there is no chance of failure. But if it is done during a pregnancy, of course, there are some risks involved, although we still do recommend patients for going this treatment because it is better than doing nothing and better than letting the threatened miscarriage develop into a inevitable miscarriage. So there are several conditions that these procedures can be done, as I've mentioned previously. Before pregnancy, this is the best to secure and prevent any form of potential dangers during your pregnancy. During early pregnancy, let's say we have detected that you do have a cervical incompetency or short cervix, this can be done during early pregnancy if diagnosed and detected earlier. Early pregnancy also gives you a significantly high success rate and does nothing to affect your pregnancy. During a late miscarriage, late pregnancy, let's say in the 5th or 6th month, you have been diagnosed and you are starting to experience certain symptoms of the threatened miscarriage in your late pregnancy. This treatment can be done, but although there are some risks involved, but we do highly recommend it because you don't want a threatened miscarriage to develop into a inevitable miscarriage. Lastly is a acute treatment, which is sort of an emergency treatment because this acute treatment is when the cervical problem has been detected quite late into the pregnancy and patient has already started to experience symptoms of a late threatened miscarriage, and it is also detected that not only the outer orifice is opened, the inner orifice is also beginning to dilate. Now this condition is highly risky, but we do still recommend patients to go for this treatment because there is still a chance to save the pregnancy by applying our anti-cervical ring. Although risks are involved, especially so late into this pregnancy, but we will do everything we can to prevent it from happening. So I hope this video can give you an understanding of our anti-cervical ring and what type of conditions cause a late threatened miscarriage and how we can treat it. We can treat it before pregnancy, which is the best and recommended treatment, during early pregnancy, during your late pregnancy, which is considered an emergency treatment because there are some risks involved, and also the riskiest form of treatment is the acute treatment, which is towards the late term pregnancy, and we will do everything possible to salvage the situation to prevent the threatened miscarriage, although with the most highest risk involved.